Hi, my name is Lizzie Livingston. Today I'm getting acupuncture to treat cystic fibrosis. I am also here to treat my common cold that I am having, which appeared a couple of days ago. You're about to see Dr. Springer insert needles into my skin in specific areas for these conditions. Hey, Dr. Springer.
Hey, Lizzie, come on in. I'm Marti Springer, acupuncture physician in Tallahassee, Florida. I'm licensed in the state of Florida to be an acupuncture physician. I treat all kinds of pain, whether a person is coming in for pain or actually a named Western medical disease like diabetes, sciatica, cystic fibrosis. I treat all of those things and help the person feel better and be better all around. Okay, the first thing I'd like to do is look at your tongue, so lean on in here. Okay, stick your tongue out. Okay, it looks like it's a little white where the lung area would be. And so, guess what? It looks like you have a cold.
Yeah, which I do.
Okay. Okay, let's see again. It looks like you're tired, right?
Yep, I am tired.
Okay.
Mainly from school.
Maybe from school, yeah. Okay. All right. So when did this cold start?
A few days ago.
And did you had, the first thing when you first started getting it, did you have more fever or more chills?
I had a chill really bad, and then that's when I realized I had fever. Because usually when I have a fever, I get real hot and cold and hot and cold. And that's what I was doing.
Today I will be giving acupuncture to Lizzie for cystic fibrosis. This is something that is in the lungs, so we are always doing points that will stimulate the lung to heal, to drain of any extraneous fluid that's in there. It needs to come out. Basically doing anything to get the lungs to function better, but also along with the lungs, it's always imperative to boost the immune system and help her feel better throughout her body so that she can have the energy to heal the lungs. Okay, we are ready to give you a treatment and put the needles in.
Okay.
Okay, I'm going to turn on this diffuser with the essential oils in here that are specifically for lungs because it helps tremendously to open up the bronchioles of the lungs and breathe better. Just straight up is okay. All right. And do you want to talk about the needles or anything? Tell them what it feels like to have a needle put in.
Yeah, the needles, they don't usually feel like anything. Sometimes they might pinch a little bit, but that's about it. And it depends on where they're located.
And sometimes a needle will be felt in one place today, for instance, and tomorrow she may feel nothing at all with the needle that we put in the same place. So it just varies according to the body and what's happening in the body.
Yeah.
So I'm going to go right beside your nose. And I'm just putting the alcohol on to sterilize it. And the needles are sterile, never reused.
Woohoo.
And so we throw those away each time. So close your eyes. This one is for the sinuses. The sinuses are here and along down here, so that's to help open up the sinuses.
I didn't feel anything.
Not at all?
No, not really.
Good. But some things, you can, may actually feel things once the needle is in there, which we feel like is a good thing. Like if you feel an ache after the needle is in there, or a tingly sensation, or a spreading sensation, a warming sensation, or any sensation of movement is actually a good sign.
Yeah, I felt that one a little bit.
Was it achy?
Yeah.
Okay. Put your other hand up there too. This is also an area for headaches, right there. So in the past, because you've had some headaches, that was a good thing, because it goes to the head. That particular one goes to the head. So for headaches, sinuses, toothache, all those things that are in the head area. This one is for digestion. It's a really good one for digestion.
Yeah, I never feel that one.
Yeah, most people don't. Once in a while. Once in a while somebody will. But again, everybody's different, so you never know who's going to feel what. Here we're doing Lizzie's chest, and because it's right there next to the lung, and we really want to treat the lung. I saw what seemed to be cold in the lungs, and we're treating Lizzie's lungs anyway. So this is a very important place to do.
This part is always the part that I feel it.
Yeah. And that's probably because the main thing you're here for in the first place is for treating your lungs.
Tube that she uses to put on in the needles, and so you usually fill the tube, and sometimes you won't even notice the needle going at all.
Does this feel pretty achy when I press these areas between the ribs? So it's a sore area in the first place, and often if it's a sore, something is sore, that's an indication that there is something going on in that area that actually needs attention and maybe need a needle. And this needle is not, in this chest area, it's not straight in, because if I went straight in, we'd go straight into the lungs, but we can't do that. So we have to do it sideways. We have to put the needle sideways along the layer of the skin, just under the skin, because we don't want to puncture anything. So as an acupuncture physician, we know when, what angle to put the needle in and when. Okay, that's it. Now I'm going to put a very, very small needle and a very short needle, because there's so much congestion in the sinuses. We're going to put that right next to the nose.
Okay.
You may feel like a cat with whiskers after I put this in. But close your eyes. And right next to the nose. I'm going to count to 3. 1, 2, 3. There you go. There we go. That can be a very sensitive area because there's so many nerve endings in the face.
Right. I didn't feel it, so it's good.
Oh, you didn't? That's amazing. Yeah,
Still breathing.
it may clear up.
So it's good.
And so now I'm going to go down to the legs, where I'm going to, the first one I'm going to be putting in is one for phlegm. You know, when you get a cold, you have a lot of phlegm, and you usually have some phlegm anyway from your lungs that we always want to clear that phlegm. Ooh, did that ache?
Yeah.
And that's probably because that's a big thing for you. That's a big thing that's happening, and so you feel quite an ache. But did it just last temporarily?
Yeah.
And then do you feel it now? You still feel it?
Not as much. Slightly.
Did it feel like a little spasm?
Yeah.
And that's something that happens too. But as long as it's something that you are comfortable with, that you can handle, because I'm not here to
Put me in pain.
torture you
Torture me.
by any means.
But it lasts like a second. So.
Yeah, so it lasts just a moment, and you might have some leftover ache. And actually, as the energy circulates through the body with the needles in, it might come back to that area and start an ache again. But it'll usually go away. Good side effects about having a needle in is that it can be extraordinarily relaxing, because the needles send a message to the brain, and the brain stimulates endorphins and serotonin to be made, which are our feel-good hormones. Now I'm going going to put a needle right here, which is for clearing some heat. Did you feel that?
Not much.
Okay. I believe we're done. This breaks up inflammation in the sinuses, but the laser is good for for inflammation anywhere, basically, and any points of pain. Anybody with any points of pain. So it could be knee pain, it could be pain in one's intestine. This is actually even good to laser over the heart, because it's really good to help kill bacteria in the blood and other bad things that are in the blood. It's very anti-inflammatory and oxygenating for the blood and the tissues.
Okay, she's about to take the needles out, and she's going to use a cotton swab to keep the energy in, or not swab,
In the hole.
in the hole, to keep the energy in. And this part doesn't feel like much of anything.
Okay.
Oh, they are? Alright. Yay!